Greetings everyone, this is Jed Schlackman, and for this video I'll be speaking about the topic of post-pregnancy healing. Before I go further, I'll just make a quick disclaimer that this video is intended for educational purposes. It's not intended to replace the care of a qualified healthcare professional for diagnosis or treatment of any health concerns that you may have. Now, of course, with pregnancy, it's pretty obvious to most people that there's a lot of stress involved in that experience. And this involves both physical stresses as well as psychological and emotional stresses. So there are some big changes in a person's life when they experience a pregnancy and give birth and begin taking care of that child. Physically, of course, the body is under a lot of pressure and stress. There's the saying that a woman eats for two when she's having a child, so there's a lot more requirement for nutrition. The nutrients that the woman is consuming are in part going toward nurturing and sustaining that child that's growing inside. So it's fairly common for nutritional deficiencies to develop. When a woman goes through labor and delivers the child, of course there's some intense stress that's put on the body in that process. So there can be a lot of pain and recuperation time afterwards for the body to kind of repair and regenerate itself in the areas affected by the delivery process or any surgery that may have occurred to assist with that process. So afterwards, of course, the mother is going to be taking care of the child, often nursing the child. So there's ongoing stresses and responsibilities. Now, of course, there's a positive side to all of this, which is that the mother has this new being that she's there to provide love and caring to. So there can be a lot of joy in that aspect, of course. However, there is a great sense of responsibility, of pressure to do one's best to make sure that no harm comes to that child, to make sure everything is going okay. So there can be a lot of anxiety or fears that come up. Also, after pregnancy, it's common for women to experience postpartum depression, and there can be both psychological and physiological factors that are contributing to that. Imbalances or disturbances in hormones, difficulties with sleeping, deficiencies in nutrients, or lack of exposure to the outdoors and to sunlight for vitamin D. So we can look at many different factors that could be contributing toward stress, toward anxiety, toward depression, toward imbalances in hormones or other aspects of body chemistry. Now, when women come to a conventional medical doctor with some of those symptoms, often the doctor will just try to prescribe some type of medication to treat the symptom. However, in many cases those medications could actually cause additional problems, and they're generally not really addressing whatever's causing the symptom. So it's helpful to look for some more alternative and holistic approaches to address these issues and to help bring oneself back into balance to recover from those stresses. Some of these are things that you can do with your diet and nutrition. Women may often benefit from taking certain supplements. If you're dealing with anxiety, there are nutrients like magnesium and B vitamins that can help. There are amino acids that help relax the nervous system. There are a number of different herbs that help calm or balance the nervous system. There's also things like massage, acupuncture, Reiki, or other forms of energy healing, breathing practices, meditation and mindfulness practices, using sound vibration or music therapy to help relax. So these are some of the different approaches that could aid a woman who's dealing with anxiety, or also someone who's having trouble falling asleep. When there are sleep difficulties as well as depression issues, it's often helpful to get some extra tryptophan. Tryptophan is the amino acid that the body requires to synthesize melatonin and serotonin. Melatonin is the hormone associated with the sleep state, and serotonin is the neurotransmitter that's very widely correlated with depression issues. So if you're deficient in tryptophan, that could foster some of those concerns. And of course, tryptophan is something that's in foods naturally. So women could look for more of those types of foods that have tryptophan. Certain fruits and nuts, certain types of meats or dairy foods have tryptophan. So those are things that are pretty simple to address, changes with your diet and taking supplements. Also, there are the psychological stresses that are present, and when someone's feeling extra pressure or extra burdens, or perhaps now that they've become a parent, they're feeling a lack of support from other people in their family who they would have hoped could assist them. There could be a sense of abandonment or neglect or betrayal, and so those emotions are something they may need to process, and it's valuable to have a support network. So if you're dealing with those emotional issues, you can reach out to find social support, perhaps support groups who consist of other women who are in a similar situation, who are dealing with the fallout of a pregnancy and the challenges that that could bring them. If this is something that you want to address on a spiritual level, you could look into different spiritual teachings or spiritual practices to help bring you more inner peace, more faith and trust in the process of parenting, of recovering from any stresses you may have experienced through the process of pregnancy and delivery. One thing to be conscious of is that when you're going through a pregnancy, you have this other being that's growing within your body, and so there's sort of these two energy fields coexisting with one another. And so the existence of that baby and its energy there can throw the mother's energy out of balance. And following the birth, it's helpful to do some practices that can kind of help rebalance and realign the energy. So that's a time where energy healing can be very beneficial, where the mother is going to be able to come back into her own natural individual energetic state or energetic alignment. She's no longer having to adapt or adjust her energy patterns to foster the growth of the baby inside of her. She's now able to shift back toward her normal energetic cycles and patterns. Sometimes that can take a while, but if you do different methods of healing that help expedite that rebalancing of the energy, it can speed up the recovery process. Another thing to be conscious of is that when there's physical tissue repair that needs to occur, it's helpful to provide some support to the body to give it certain types of nutrients that help nourish that process also. So often eating a lot of fresh raw fruit can be beneficial, especially fruit like pineapple and papaya, which have a lot of proteolytic enzymes. Those are the enzymes that can break down and help replace proteins in the body. So they're good for helping rebuild tissues that have been damaged or scarred in some way. Those also help a lot with pain. So if you're dealing with pain after a pregnancy, rather than relying on pharmaceutical painkillers, you can use some more natural approaches. You can use things like acupuncture or Reiki or massage to help relieve pain. You can use hypnosis and meditation. And you can use various supplements that help relieve pain in the body. Things like magnesium, turmeric, and ginger. You can also use the proteolytic enzymes that I mentioned. Those actually are very helpful for repairing the tissues, which in turn helps reduce the inflammation and pain. So that has a double benefit to it. For those that are interested in holistic health and well-being, I encourage you to seek out additional resources. There are most likely many practitioners in your area who can provide some of those types of services or additional guidance to help you address your health concerns. You can also visit my webpage, which is phinsights.com, phinsights.com. There I have a links and education section where there are links to many different resources on the internet to support you on your holistic health journey. For now, I want to thank each of you for taking your time to view this video. I'd like to wish everyone a wonderful day. Namaste.